the repeatable formula to crack the drug classification in pharmacology. For every drug family, revise in this exact order. Main class, name ending or a pattern, prototype examples, one key clue. ANS classification. Statpearls groups autonomic pharmacology into four big buckets: cholinomimetics or cholinesterase inhibitors, anticholinergics, sympathetomimetics, and adrenergic blockers. That gives you the first master map. Cholinergic drugs. Remember in two groups: direct acting cholinergic agonists, example bethanechol, pilocarpine, carbachol. Memory, direct cholinergics do the job themselves. High yield clue, muscarinic effects. Indirect acting cholinergics, example neostigmine, pyridostigmine, physostigmine, donazepam. Memory, indirect is equal to increased ACH. High yield clue, myasthenia, reversal, Alzheimer type recall. Next, anticholinergics, example atropine, scopolamine, tiotropium. Memory, anticholinergic dries and dilates. High yield clue, dry mouth, mydriasis, urinary retention. These sit opposite to the cholinergic action in autonomic classification. Sympathetomimetics, example adrenaline, noradrenaline, salbutamol, phenylephrine, dopamine. Memory, sympathetic is equal to stress drugs. High yield clue, tachycardia, bronchodilation, vasoconstriction. Adrenergic blockers split into alpha blockers, prazosin and tamsulosin, beta blockers, propanol, atenolol, metoprolol. Memory, alpha blockers is equal to prazosin family, beta blockers is equal to olol family. CVS classification. Antihypertensives, the 5-box trick. Remember only these 5 first. ACE inhibitors, pril, enalapril, ramipril, hook. Pril is equal to pressure down. ARBs, sartan, losartan, telmisartan, valsartan, hook. Sartan saves from angiotensins. Beta blockers, olol, atenolol, propanolol, metoprolol, hook. Olol slows the heart. CCBs, calcium channel blockers. Prototypes, amlodipine, nifedipine, verapamil, diltiazem. Hook, dipines dilate. Diuretics, 5 groups. Loop, furosemide, thiazide, hydrochlorothiazide, K-sparing, spironolactone, amiloride. Osmotic, mannitol. CA inhibitor, acetazolamide. Memory for diuretics. Loop, thiazide, K, save, osmotic, Ca, or lazy tigers keep owls calm. Next, anti-anginals. 3 main groups: nitrates, GTN, isosorbide, beta blockers, atenolol, metoprolol, calcium channel blockers, amlodipine, diltiazem, verapamil. Memory, angina is equal to open vessels, slow heart, reduce the work. Antiarrhythmics, Vaughan William shotgun. Class 1, sodium channel blockers, quinidine, lidocaine. Class B, beta blockers, metoprolol, propanolol. Class 3, K channel blockers, amiodarone, sotalol. Class 4, calcium channel blockers, verapamil, diltiazem. Memory, some block potassium channels: S sodium, B beta, P potassium, C calcium. Next, CNS classification. Benzodiazepines. Pattern, usually PAM, LAM. Examples, diazepam, lorazepam, clorazepam, alprazolam, midazolam. Hook, PAM, LAM, calm. Antidepressants. Learn the 4 boxes: SSRIs, fluoxetine, sertraline, escitalopram. Hook, SSRI is equal to serotonin specific. SNRIs, Venlafaxine, duloxetine, hook. SNRI is equal to serotonin plus non-adrenaline. TCAs, amlopetrin, imipramine, nortriptyline, hook. TRI is equal to tricyclics. MAO inhibitors, phenylzine, tranylcyclopene, hook. MAO, old but important. Antipsychotics, two box tricks, typical. Haloperidol, chlorpromazine, hook. Typical is equal to more EPS. Atypical, risperidone, olanzapine, clozapine, quetiapine, hook. Atypical is equal to metabolic, clozapine special. Anti-epileptics. Best exam-friendly way is by mechanism. Calcium channel blockers, phenytoin, carbamazepine, lamotrigine. Calcium channel blocker style, ethosuximide. GABA enhancers, benzodiazepines, valproate. Broad spectrum, valproate, levetiracetam, lamotrigine. Memory, sodium, calcium, GABA, broad. Endocrine classification. Anti-diabetics. Make just 6 boxes. Biguanide, metformin. Hook. Biguanide is equal to big M, metformin. Sulfonylureas, gilbenclamide, glycazanide, glipizide. Hook. GLI drugs that push insulin. Meglitinides, repaglinide, nataglinide, hook. Clinide is equal to mealtime release. DPP4 inhibitors, gliptin, sitagliptin, vidagliptin. Hook. Gliptin is equal to DPP4. GLP-1 agonist, tide, liraglutide, semaglutide, exenatide. Hook. Tide drugs trim the weight. SGLT2 inhibitors, flozin, dapagliflozin, emaplaclozin. Hook. Flozin flushes glucose. Thyroid drugs, hypothyroid replacement, levothyroxine, antithyroid drugs, carbimazole, methimazole, propylthiouracil. Memory, hypo gives the hormone, hyper blocks the hormone. Respiratory classification, bronchodilators, 3 boxes only. Beta 2 agonist, SABA, salbutamol, LABA, salmeterol, formoterol. Antimuscarinics, SAMA, ipratropium, LAMA, tiotropium. Methylxanthines, theophylline. Memory, asthma, COPD, beta muscarinic xanthine. Steroids. Example, beclomethasone, budesonide, fluticasone. Hook. Steroids suppresses the swelling. GI classification. Anti-ulcer drugs. This is one of the easiest classification topics if you learn by the suffix. PPIs, prazole, omeprazole, pantoprazole, rabeprazole. Hook. Prazole protects the stomach. H2 blockers, tidine, famotidine, cimetidine. Hook. Tidine turns the acid down. Antacids, magnesium hydroxide, aluminum hydroxide, calcium carbonate. Antacids neutralize. Mucosal protectives, sucralfate, bismuth. Hook. Protects the ulcer base. Antiemetics, 4 box trick, 5-HT3 blockers, ondansetron, D2 blockers, metoclopramide, prochlorpresine. H1 blockers, promethazine, antimuscarinic, scopolamine. Memory, onda, metto, pro, scopo. Antimicrobial classification. This is where students panic the most. Do not learn by the chapter. Learn by mechanism family. Cell wall inhibitors. Penicillin, penicillin, amoxicillin. Cephalosporins, ceftriaxone, cefixime, cefuoxime. Carbamazepines, imipenem, meporipin. Glycopeptides, vancomycin. Memory, wall drugs break the wall. Next, protein synthesis inhibitors, 30S inhibitors, aminoglycosides, gentamicin, amikacin, tetracyclines, doxycycline. Then we have the 50S inhibitors, macrolides, azithromycin, erythromycin, clarithromycin, clomifenicol, clindamycin, linezolide. Hook, thymosin, macrolide, cycline, tetracycline type family. Next, DNA or nucleic acid inhibition. Fluoroquinolones, ciprofloxacin, levofloxacin, moxifloxacin, rifampicin, metronidazole. Hook, floxacin is equal to quinolone. Folate antagonist, sulfonamides, trimethoprim, cotrimoxazole. Memory, folate blockers starve the bacteria. Antifungal classification, learn the 4 types: azoles, fluconazole, itraconazole, ketoconazole. Hook, azole is equal to antifungal alert. Paulines, amphotericin B, nystatin. Hook, Paulines punch holes. Echinocandins, caspofungin, hook, fungin family. Allylamines, terbinafine. Comment pharmac classification and I will be happy to share the sheet with you, the cheat sheet. Final master line: don't memorize drugs as names, memorize them as families with faces. Family is class, face is prototype, surname is suffix or a stem, personality is one key clue. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.